Katie. All right. Good morning, everyone. Thank you for joining us at the 2020 AHI Leadership Summit. This is our 12th annual event, our first ever virtual. The theme of this year's event is Uniting the Future of Population Health and Virtual Care. This theme was picked back in December when we started planning this event, so it's interesting. It's extremely telling for this current environment that we're in. We are very glad that you could join us. My name is Courtney Shaler. I'm the manager of the Adirondack Rural Health Network for AHI. I'd like to welcome you today on behalf of our CEO, Eric Burton, our AHI Board of Directors, and the staff here at AHI. Today, the first session is addressing and overcoming health disparities in the LGBT community. We have our presenters are Sue Wendelglass and Rachel Marcy from Planned Parenthood of Greater New York. We'd like to take a minute to thank all of our sponsors. This event's been going on for 12 years, and we would not have been able to lift this event up and bring it to all of you here without them. We hope to all be in person next year in Lake Placid, so you can all chat and meet these sponsors in person. Okay, before we begin, I'd like to go over a few best practice tips to make sure you can get your most out of enjoying the summit today. Please confirm that you're muted and your video is off upon entry. To avoid audio issues, we encourage you to either use your computer audio or your phone audio. Using both may result in an echo on the line. For optimal viewing, we recommend you use the side-by-side mode. This will allow you to see both the speaker, our presenter, and the slides at the same time. To activate side-by-side mode, click on View Options at the top center of your screen and choose side-by-side mode from the drop-down. Please use the chat freely to submit all questions, comments, and any technical issues. AHI staff is going to be monitoring and will ensure that anything you need will be taken care of. We will be archiving both the presentations and the recordings of this session on the AHI Conference's website by October 9th. Thank you all for joining us today. I'm now going to turn my screen sharing ability over to our presenters, Sue and Rachel. Thank you, Sue and Rachel.
All right, thank you, Courtney. Can you see my screen okay?
Yes.
Okay, perfect. All right, thank you everybody for joining us today. I'm Sue Wendelglass. I'm the Director of Specialty Training and Programs for Planned Parenthood of Greater New York. I've worked for Planned Parenthood for over 20 years in a variety of roles, but I have to confess one of my favorites has been working on the AIDS Institute LGBT Individuals, Families, and Communities grant with my colleague, Rachel. Rachel?
Good morning, everyone. I'm Rachel Marcy, the LGBT Outreach and Engagement Manager for Planned Parenthood of Greater New York. I've held a few different roles with Planned Parenthood over the last 7 years and have been working with Sue under the LGBT grant since May of 2019.
All right, thank you. All right, so today we're gonna start with our learning objectives. And by the end of our hour together, you'll be able to identify 3 reasons LGBT people report an overall lower level of well-being than non-LGBT folks. You're going to be able to identify 3 common mistakes people make when working with LGBT persons and discuss actions you can take to make your office and agency more welcoming to the LGBT community. And I want to add that for the last learning objective, Rachel's going to give some very concrete steps. So we're not going to just give you theoretical stuff today. We're going to give you some concrete assistance. But before we start, we wanted to define our terms because there's a lot of terms that get thrown around out there, and we wanted to make sure everybody knew what we were talking about. LGBTQ+, that's a big acronym, so we're going to break it down into pieces. The L, G, and B are all similar terms. They all relate to sexual orientation. They are talking about who someone is romantically or sexually attracted to. So L stands for lesbian. Lesbian is women who are attracted to women. Gay stands for gay. G stands for gay. And gay is a term that sometimes is used just to describe men who are attracted to men, but actually the term gay means someone who is attracted to their same gender. So sometimes you'll hear a woman say she's a gay woman. That's a proper use of the term. B is bisexual. Bisexual people are attracted to more than one gender. Transgender, the T stands for transgender, and transgender is not a term that talks about sexual orientation. Transgender people can be of any sexual orientation. What A transgender person is someone whose internal sense of themselves doesn't match the sex they were assigned at birth. Just a reminder, we're all assigned a sex at birth. When you're born, the doctor or nurse practitioner looks at the baby and says, congratulations, you have a boy or you have a girl. That goes on the birth certificate. And that is the assigned sex at birth. So a transgender person, that sex that was assigned doesn't match how they feel about themselves. Q stands for questioning or queer. Questioning is someone who's still exploring their sexual orientation and or gender identity. And queer is one of those tough terms. Rachel and I had a big discussion about it last week. Queer used to be a slur, an insult that was thrown at people who were LGBT for many, many years. So a lot of people in the LGBT community won't use it. But some folks have decided to reclaim it and to call themselves it, to basically claim it and own it. So depending on the person, they may or may not be comfortable with using the word queer. And the plus, lastly, is just, let's just include any new terms that come along. There's always new terms that are coming, they're always adding them. So rather than continue this very long acronym, even more letters, the plus is inclusive. Now, sometimes people say, well, exactly how many people are LGBT? What are we talking about here? Well, in the past, the US Census has actually not asked about sexual orientation. So the numbers have been pulled from private studies. Now, in 2019, a study commissioned by the Williams Institute out of the UCLA School of Law estimated that about 4.5% of the population self-identified as LGBT. However, the numbers differ hugely across generations. In 2016, a survey was done of Generation Z, that is people who would now be in their late teens, early 20s, and over 50%, over half, identified as LGBT. In 2017, they surveyed millennials, those are folks currently in their 20s into their 30s, and about 20% of them described themselves as LGBT. I don't want you to worry about memorizing these numbers because the numbers are always going to change. But what I would ask you to take away from this is, this means that chances are, whether you know it or not, you're already seeing LGBT people in your offices and in various aspects of your life. Now, a few more terms before we move on, and I promise we will stop very soon. Gender is, as I already mentioned, the sex assigned at birth. If you identify, if you feel the sex that assigned at birth was correct for you, that is called cisgender. As I already mentioned, if you feel it doesn't match who you feel you are, that is transgender. Now, the US is a binary country. We make people choose between one of two things. For example, in most of the country, birth certificates only say male or female. Some places are opening up a little more, but generally it's still male or female. The problem with that is there are people who are non-binary, people who do not exclusively identify as male or female. You may have someone who says, some days I feel more female, some days I feel more male, or someone who says, I am not either. So what we want to do is just make sure folks know that there are non-binary folks out there. A lot of these folks use the pronouns. You may be hearing new pronouns of they or them. A lot of folks use they and them to describe themselves because they don't identify with she or he. And gender expansive, gender nonconforming describes how people who do not necessarily follow the stereotypes about what we should look like. And that is very regionally based. For example, in the US, it's a lot easier to be a female than it is a male in terms of being gender, in terms of not having to worry about being gender nonconforming. Let me use myself as an example. If I never wear a skirt or a dress again in my life, no one's going to look at me sideways. But if I go to a big family event and my brother shows up wearing a skirt, people are going to look funny at him because that's gender expansive, gender nonconforming. But if he's over in Scotland wearing a kilt, nobody's going to look because that's very normal. So it really is based on the region where someone is. Now this is just for those of you who hate lists of words and are more visual learners, this is something we developed in our offices at Planned Parenthood. And I'm going to start in the middle at the bottom. So just to recap the terms, biological sex is the sex someone's assigned at birth, generally male or female. Going up to the heart, sexual attraction, who you are attracted to. To the top, gender identity, who in your head you feel you are. And down the left-hand side, gender expression is how you put it all together, how you show other people who you are. This involves things like how you dress, how you walk, even the name and pronouns you use. That's the full package. And all these pieces make up our human being. So that's it for terms. I promise we're done with them. And now we're going to move on to health disparities. We're going to move on to that topic because that's what we wanted to be talking about today. The dictionary defines disparity as a great difference or an inequality. And many of us have heard about social determinants of health, but when I've talked to people, they don't always quite get how they relate to health disparities. So the social determinants of health are the social, economic, and environmental factors where we live that impact our health as much as or not even or more than whether you see a doctor or your genetic makeup. The social determinants of health are things like, are there full-service groceries locally that sell healthy foods? Are there parks and playgrounds and green spaces? Do the schools have a high-quality education? Are there good-paying jobs, decent, safe housing? Even as basic as the water safe to drink and the air clean to breathe. So here's the key. People who live in areas with these positive aspects that I just talked about, they have an advantage. They have better overall health outcomes before they even do anything. It's a health disparity. So the flip side is people who don't live in these areas that have these qualities have poor or worse health outcomes. So before they even do anything, they're likely to have worse health outcomes. And health disparities have historically affected people who've been excluded or discriminated against by the larger population. This includes people of color, people who have lower income, people with mental health issues or disabilities, and people who are LGBTQ. So now we're going to look at how this happens and how it plays out. People who are LGBT report lower levels overall of physical health, financial security, sense of purpose, social life, and community attachment than non-LGBT people. And so to illustrate this, I'm going to tell you a story. I'm going to tell you about Michael. Michael grew up in a suburb of the capital region. At a young age, Michael decided he liked pink and he liked to play with dolls. His parents struggled with this and tried really hard to get him to do boy things. When Michael went off to school, as you can guess, he became a target for the bullies, and he was bullied for years, physically and emotionally. Because Michael was different, people in his hometown, his small hometown, called him Freak or the Loser. The only real support he had was his grandmother, but she lived far away, and he didn't get to see her a lot. Michael thought about suicide because life was hard. And when he was a young teen, he realized he was gay. And in an effort to establish his own identity, he asked to be called by a version of his middle name. His middle name was Daniel. He wanted to be called Danny. His parents and people at school refused. He felt alone and moved out of his parents' house when they made it clear he wasn't going to be welcome if he was going to continue to act this way. Now, I'm going to continue as we go along to call him by his preferred name. So Danny dropped out of school as soon as he could. As we move ahead with the next few slides, we're going to use Danny to illustrate how social determinants of health and how this all affects how he feels about himself. So back to Danny. When he was little, his parents took him to the doctor to see if he could help their son be normal. As you can guess, it was not a good experience. The doctor called him Mike, even though he'd already begun asking to be called Danny. Imagine how it must feel to have something as simple as the name you want to use be ignored by someone. So Danny took up smoking and drinking to handle stress at a young age. He avoided all doctors based on his experience. He worked a series of low-wage jobs with no health insurance, and he really couldn't afford to go to the doctor anyhow. When he desperately needed emergency care because he was injured on the job, he went to the local walk-in clinic. And here's where it gets sad. Danny presented himself as a straight man using a name he no longer liked, Michael, because he didn't want to get hurt again. He remembered his past experiences with doctors and said, I can't do it. So he basically presented himself as society wanted him to present. So here's where the physical health slide comes in. When LGBT people have negative experiences, which is very common in health offices, the impact is what all of us would do. They avoid seeking services unless it's absolutely necessary. LGBT people are less likely to have health insurance. If they do have health insurance, they're less likely to be able to afford out-of-pocket costs like copays and deductibles. If they do go to the doctor and are prescribed medication, they're less likely to be able to afford to pay for it. And fewer LGBT people have primary care physicians than non-LGBT people. And when they go to the doctor, they often aren't honest due to fear of how they're going to be treated. This is very common in the LGBT community. There's some other barriers that folks run into when they go to providers. And while our slide says healthcare workers, I'm going to generalize this to a lot of people because I think even human service workers don't necessarily get the training. There's a lack of education and training, particularly for physicians. The average physician is in training for about 10 years through medical school and residency and all that. If we were live, I'd ask people to guess how many years or how much training on average they have on LGBT issues, health issues. But because we aren't live, I'm going to give you the answer. It's 5 hours. That's in 10 years. 5 hours of training on average on LGBT health issues. So that means the average healthcare worker probably doesn't know a lot about it. And then we also don't have data and research because it's not done on a national level. Instead, we rely on groups, and I want to give a shout out here to the National LGBT Cancer Network, the Human Rights Campaign, and the Trevor Project, 3 LGBT groups that Rachel and I relied on heavily for statistics that we're using during today's presentation, because the LGBT groups do their own data and research on health-related issues. And then there's just fear. There's fear because folks learn at a very young age that if you go and present as you are likely to get treated badly. And so folks try and avoid going into healthcare and other social service agencies as much as possible. I'm also going to say this relates to family and friends because sometimes people talk to family and friends and say that they're LGBT and get negative responses based on lack of education. The thing is, if we don't all have a clear understanding of what the LGBT community faces, it's harder to help people and to make them feel safe. So let's look at specifically what goes wrong when people go into an office. First of all, people get misgendered or they're not offered options. Think of paperwork when you go to a doctor's office or any provider. Does it just say sex, male or female, must check 1? In that case, we're excluding a lot of people, the non-binary folks I talked about earlier. If someone goes in and it doesn't include how I view myself, I already feel excluded. Misgendering, it's funny, I was just having a conversation with some friends this weekend, all women with short hair like myself, and several of them said now that they've had to start wearing masks and going into stores, that they're being called sir routinely because people automatically are making assumptions based on hair length that they are male. So what happens is assumptions are made and people speak based on those assumptions, which then puts folks off. We call people by the wrong name or pronouns. It's respectful to call people by the name they prefer and the pronouns they want to be called. Using terms of endearment, that's one of those that I think gets everyone. My 90-year-old mother used to hate being called dearie or sweetie because she was a small woman. But if you don't identify as a female and someone's calling you dearie or sweetie, it's really offensive. The other thing is there's what I've heard referred to as terms of respect. Someone told me once, well, I grew up in the military, so I call everyone sir or ma'am. And I said, but what happens when someone doesn't identify as sir or ma'am, but identifies as something else? And they said, well, I just call them sir or ma'am, whichever seems to make the most sense to me. Again, People don't want to come back if that's how they're treated. And sometimes LGBT people work up the courage to say, please don't call me that, or please call me this, and run into someone who says, I've always done it this way and I'm not going to change. And right there, you've lost someone. And we all know folks in the LGBT community who've been humiliated, mocked, laughed at, had staff actively show discomfort working with them, and minimized. You'll figure out who you are at some point. It's just a phase. All of this kind of stuff contributes to people feeling badly. So let's see how this played out for Danny. After Danny moved out of his parents' house, he went to 2 different agencies to get help. One for a job, one for housing. He quickly learned some places are better than others. The one office called him Danny, treated him with respect, and worked closely with him without any seeming discomfort. The other would only call him by your legal name. The staff were cold and acted like they wanted him out of their office as soon as possible. Danny decided he'd never go back to the one, but was happy to find an agency that seemed okay and worked with him. However, as good as this might sound, the reality is it meant he didn't get access to some services he needed. And again, that contributes to an inequity in his life. Here's a statistic I just want to leave us with on this slide. 45% of transgender people have not told their family physician that they're transgender. Why? Because they don't feel safe. That's a bad sign. So mental health, the big piece of overall well-being is our mental health. And what we know is rejection, abuse, and stress, they take a toll on people. Lesbian, gay, and bisexual youth are almost 5 times more likely to have attempted suicide, and 40% of transgender adults reporting having attempted suicide. But here's the positive piece here, and this is that small changes have a big impact. In the states that legalized same-sex marriage before the Supreme Court decision a few years ago, they found an almost immediate reduction in calls to LGBT mental health hotlines and a decrease in adolescent suicide attempts. What we know is that health disparities are caused by discrimination and exclusion. So if we can offer LGBT people social acceptance through marriage and other equal protections under the law, as well as by education efforts such as this, we can reduce the health disparity. We can make people feel more part of society, and this in turn makes people healthier. So that's a real positive piece in all of this. Financial security. Danny never finished high school. It was a really bad experience due to bullying. We know if people don't finish school, it limits your income potential. We also know LGBT people may not get hired or promoted or may be fired due to LGBT status. And even though technically the Supreme Court ruling made that illegal in most situations, most employers know how to get around the laws if you just don't say why you're firing someone. Other factors to think about. Unemployment. LGBT people are more likely to be unemployed. They have higher levels of unemployment. And transgender people have 2 to 3 times higher levels of unemployment. If you don't have money, you have limited transportation. We all live in the North Country. We know how important transportation is. We don't have buses that take us where we need to go, or subways, or the other stuff that big cities have. Limited transportation limits your opportunities in life. Food insecurity is 2 times higher in the LGBT population. In the LGBT people of color communities, it's even much higher. And homelessness, LGBT people are twice as likely to be homeless. So here's the thing. When I started talking originally, I told you about positive social determinants of health. And Danny actually grew up in a community that had those positive pieces. But what happened was, as he got excluded, as he got bullied, as he was told he didn't belong, he ended up leaving that community and moving to an area where he was less recognized and less abused, but he had less advantages. So that ended up really affecting his quality of health. And this is, I think, in some ways, one of the biggest things for people, a sense of purpose, community attachment, and social life. If we're Danny wasn't accepted by his family, community, school, or even his employer. What we know from studying trauma is that people who have serious trauma tend to internalize it, and they expect they're going to get hurt again. If your family rejects you, that's traumatic. We know youths from families that are highly rejecting are 8 times more likely to attempt suicide. If you're bullied and threatened in school, that's traumatic. So here's the statistics that I find almost more heartbreaking of any of the ones we talk about today. We know that if LGBT people live in a community with high levels of anti-gay prejudice, they die 12 years earlier than their peers in other communities. That's a big health inequity. But before I turn this over to Rachel, I want to go back to what I said one slide ago. And while it's easy to get caught up in the negatives, positive changes ripple out all over. What we know is that if Cornell University just did a study where they reviewed hundreds of studies on LGBT health. And what they found, if people had acceptance in the family and community or any peace, they were healthier. And that's why you'll find some areas like Provincetown, where there's a community of LGBTQ people, New York City, where people go because they know there's a larger community and they can be accepted. Our sense of purpose and community attachment is critical. And as Rachel's going to talk about now, we can all play a part in this.
Thanks, Sue. Good morning, everybody again. So this is our COVID slide. We have to talk about it, of course. So as we know, the COVID virus has had a tremendous impact on all of our lives, many, many ways. With a community that already faces high levels of disparities, you can see how this would take circumstances from bad to worse. And there was a primary concern around isolation to begin with. Agencies and organizations moved really fast to respond to this concern. And we saw that meetings, support groups, events were all going virtual, and again, really quickly. At the end of the presentation, we will also offer connections to these resources, so we definitely won't leave you hanging without those. While virtual events have been a lifesaver for some, we also are aware that technology can also be a barrier. Primarily, as Sue mentioned, up in the North Country, we have spotty cell service, poor internet connection. So while it's wonderful to have virtual events, it's not necessarily the only answer. Something like having a reliable cell phone right now can be essential to accessing services, from contacting your doctor's office for an appointment to bringing your pet to the veterinarian. Cell phones are pretty essential right now. So if you can't afford one or don't have one, how do you function? How do you interact with people? How do you communicate with others? From an employment aspect, what about those who worked in service industries? Some studies say that up to 60% of small businesses may not survive, or at least not at the same level of staffing as before COVID. So think of how this affects the LGBTQ community, who are often relying on these jobs. So the good news is there is something that we can do. I know the first half of the presentation is a little like, it's pretty heavy, but this is where we come in. So showing support to the LGBT community really does start with you. It starts with one person making a difference. That's always like a cheesy thing to say. People hear it and they're like, oh, it's very cliche, but it is very true. And what it means to show your support is to be an ally. And that is the key, is showing your support, visible support. It can be as simple as a rainbow ribbon attached to a lanyard, a t-shirt, name tag, a pride flag in the room, a rainbow sticker in the window. On the slide here, you see a couple of examples. The top left is the equality symbol from the Human Rights Campaign that Sue had mentioned earlier. It's very subtle, but it really speaks volume to the community. Also shown on here is the trans pride flag, and this was designed by a transgender woman, Monica Helms. Just again, a few examples of some things you can do. We really want to help get you thinking of how you would like to show your support. And if your agency is not yet doing these things, or your family is not yet doing these things, what can you do in your space that friends, family, staff, clients can see it? People in the LGBT community will be looking for it. The word will spread. It will be noticed. So this slide here is, we wanted to really give you some tools to be able to walk away with. And this is a tool that you can use just to start making a difference in your surroundings. On the left side, you'll see a best practice. These are basic guidelines. In the middle are situations LGBT persons have encountered. And on the right are just slight changes you can make to these interactions that will really improve the quality of care. So we're just going to go over a couple of these. The first one, avoid specific gender markers. Instead of saying, do you have an appointment, sir or madam? Sue had mentioned about sir and madam earlier. We never want to make assumptions about a person based on their appearance. So this person, for example, may identify as non-binary. Sir or madam would be wildly inappropriate to use. So instead try, how can I help you today? Or do you have an appointment? Completely avoiding using titles until you're sure how this person identifies. Also, politely ask for the person's preferred name and pronouns. Instead of saying, what's your real name? We would want to say, what name and pronouns would you like me to use? And most importantly, use them after that. Again, never making assumptions. While some people use traditional pronouns of she and he, some people may also use other pronouns such as they, zay, or z. So again, asking is better than assuming, for sure. We want to be aware of our language and really know that what you say and how you say it matters incredibly to that person. So again, just want to leave you with this, and we'd like you to start thinking about how maybe you could use this in your work or your life to start making that change. Larger scale changes. If you're in an office setting, can the forms you use be edited to offer choices for gender identity and relationship status? It's best practice to include a write-in or choose not to answer options as well. Again, asking for preferred name and pronouns and using them throughout the interaction is so important. It's also really important if you are part of an agency or even as a person, individual, as a family, to participate in your local Pride events and partner with local LGBT-friendly agencies. Planned Parenthood of Greater New York is always looking to partner with community agencies in general, and also Adirondack Health Institute has networking opportunities through their LGBT series. We also want to encourage you to do an honest walkthrough of your space, of your office, of your home. What would someone who was coming into your space see? If you're in an environment where you have a gay-oriented magazine, is it aimed at white gay males only? What would a person of color see if they came into your space? Do you even have LGBT-friendly magazines? Really think about, what is your signage saying about the space? Who is seen there? Who is heard there? Who is welcome there? Are bathrooms in your office marked men's room and ladies' room? Would you consider changing to an all-gender restroom, shown in the slide here? It says anyone can use this restroom, regardless of gender identity or expression. Something as simple as that can make all of the difference. So we're talking about bathrooms a lot, which is a topic normally not covered that often. But why do we talk so much about bathrooms? Imagine having to use a bathroom. Very simple thing, very simple process for most of us, you think of, but you're afraid of how you'll be treated for using the bathroom. Whether it's being told to get out, stared at, pointed at, even worse. Many people won't drink fluids, so they don't have to use or find a bathroom. That's clearly unhealthy. 61% of transgender or non-binary youth have been discouraged from using the bathroom that they felt most related to their identity. 61%, well more than half. Way too many. 1% is still too many. New York State has been progressive on this issue, and last year, Assembly Bill 8109, you don't have to remember that, it's just going to show that it was signed into law requiring that all single occupancy bathrooms in state-owned and operated buildings must be designated as gender neutral. So we're on the right track, but we do have a ways to go. Sue had mentioned earlier the National LGBT Cancer Network, and this slide shows just one of their campaigns, the products from that. It was called Do Your Business, Mind Your Business. And for more info on that, you can visit bathroom.support. So this slide is titled staff training, but it really just applies to anyone in general, not necessarily just staff. Training and being open to continuous learning is critical. If you are an agency and you say that you see all people, you must do it right. If you say you support the LGBT community, you must show that support and ensure that your practices align with that culture. As mentioned earlier, education and training like this one helps to reduce health disparities. It's important to stay current and be flexible as terms can change and in agencies, staff may come and go. You also want to not expect that everyone knows or understands the information that you're trying to share. As you noticed at the beginning of this presentation, we started off with our basic acronym. We always want to be sure to set a solid foundation of explaining terms and then asking for follow-up questions just to be sure that everyone's included in the conversation and engaged in the training and the learning. Sue mentioned earlier about what about the person or family, family member, staff member who won't modify their behavior. Most people know someone with strictly binary thinking. Someone who has said, when I grew up, you were either a boy or a girl, not anything else. I'm only going to call them their given name. That's it. We want to provide learning opportunities for this person, include training and coaching as needed. Anything beyond that, as an agency or a family, you need to decide what is best for you to handle this in the way that aligns with the culture you're creating. Remember, people will talk about how well or how badly you treated or provided services to them, and word will spread. We talked earlier about what goes wrong, and here is a list of some common mistakes. Some of this is direct and others are more subtle. Again, we never want to make assumptions about a person based on their appearance, the sound of their voice, etc. Always ask a person what name and pronouns they would like you to use and use them. Remember too that pronouns are an important way for someone to reflect their self-image, so we want to make sure that we're really getting that right. It all boils down to being respectful. So we've talked about respect quite a bit because again, that's really what it does boil down to. So as you can tell, Sue and I are a big fan of dictionary definitions. So I'm going to give you the definition of respect, which is showing someone that they are worthy of your attention and concern. So we don't want to just throw around the word respect, lightly. It is something very important. It shows someone that you consider them to be important to you and to have value. Out of respect for others, we also want to avoid sharing any personal opinions, as it may not seem obvious or offensive to you. To someone who maybe identifies as LGBTQ, it may be offensive or raise some safety concerns. You may be able to think of some other mistakes. This is not an all-inclusive list. Mistakes. So we all make them and usually feel terrible after making them. What makes a difference in making mistakes is how you respond to them and if you learn from them. So you've made a mistake, you want to acknowledge it. I called you by the wrong name. Genuinely apologize. I'm so sorry, and then move on and don't do it again. We at times have a tendency to constantly bring up mistakes after we've made them because we feel terrible and we want to make it right. However, we want to remember that the apology is for them. It acknowledges the mistake and the intent to correct it. The apology is not to make us feel better or to provide an excuse for making the mistake. So acknowledge, apologize, correct, and move on. All about treating people with courtesy and respect. Don't worry, we're not going to talk about the New York State of Health today, but I did want to share this slide with you because it came out last year and it's just a really good example of how an agency has changed their practice in an effort to be more inclusive. And being more inclusive just means to provide respectful care to everyone. So it just shows you here some best practices. Never appropriate to assume a person's gender or use gender pronouns based on name, appearance, sound of voice, relationship to household members. And there's some information about using proper pronouns here as well. We sometimes think of the state as being slow to act on things, but even this just shows that if it's made a priority, it can be done. Resources, the most important part. We wouldn't leave you hanging without them. And these are just a few of the many that are available. When coming into LGBTQ topics, you may think, oh, it's difficult to find things, but rest assured it is not. The first one here is Adirondack Health Institute's LGBTQ resource page, and there is just a ton of info on here for all ages and situations. Also, that LGBTQ glossary that was sent out earlier and that's in the chat will be on here as well. The next link is Planned Parenthood of Greater New York's LGBT page. And the last here is a Planned Parenthood initiative on Facebook. It's called Out for Health. And this contains LGBT resources, information, and interactive virtual workshops. So a ton of info on there. Once you start looking for resources, you'll find an awesome online community of trusted resources who partner with other trusted resources. The information is out there. So now I'm going to turn it back over to Sue for a final word on Danny's story.
Thanks, Rachel. Oops, I moved a little too far ahead. So one more thing about Danny. The experience I described is not unique. Lots of LGBT people encounter hostility and discrimination in their daily lives. They learn to look for it, anticipate it, in an effort to stay safe and protect themselves. But here's the good news. Everybody's experience is different. Danny is actually based on the child of a friend of mine who I've watched grow up. We're going to call him Jason. Jason had a similar start in that he loved pink and he loved dolls. And when he went off to school, it was a brutal experience. But unlike Danny, Jason had lots of support from his family. They helped him get through middle school, which was terrible, and he made it through high school, and then he went to college in New York City because he knew he'd find a community there. He has graduated college, gotten a job. He is happy and healthy and one of the nicest human beings I know. His story just shows how support from family, from school staff, and from others he encountered in his life made a huge difference. What we're really asking everyone here to do moving forward is look at how you treat anybody who you encounter in your office or your life. You may not be able to change the entire culture around you, but you can change your part of it. And we know that even if one person reaches out and is kind and treats LGBT people with respect and dignity, it makes a difference. Lastly, here is our contact information. If anyone wants to contact us with questions, please feel free. We are, just a quiet plug, we're funded by the AIDS Institute to offer free staff training on a variety of LGBT topics. And if you're interested, let us know. And now I believe we're going to take questions.
Thank you so much. Rachel, do you want to unmute yourself? And Sue, do you want to stop sharing your screen so everyone can see our video? We're taking questions. Great, thank you. So we did have a few questions. I did want to say on behalf of AHI, thank you both so much for this presentation. As a parent of a trans child and as someone who works in the healthcare community, this presentation means a lot to me, and I look forward to archiving it on our conferences page and also on our LGBTQ Supporting Health and Wellbeing website. So thank you. Let's see. I was wondering if one of you could put, question came up, could you put the 3 links that you put on the slide in the chat? Could you, or Sue, could you or Rachel do that because someone wants it? We're going to put up on our website, but they want it right away. Let's see. What are some organizations, or what are some things that organizations or doctors' offices can do to make themselves more open and accepting to individuals in the LGBT community? And do you recommend specific trainings?
Yeah, so as mentioned, you know, it really depends on what your agency is ready to do. Because one of the most important things is to get started as soon as possible. So if it's something that, you know, you'd really love to just start implementing small changes first, if your agency is not ready or in a position, especially right now with COVID, there's a lot of other things going on. If your agency is not in a position to maybe begin doing large scale changes immediately, starting small with that the staff training is really important because it's very easy to slap a rainbow sticker on your shirt and seem welcoming. But if you don't have the chops behind it, it throws off the message. So we really want to be careful with that. So I would say starting with getting staff on board. And it's not about communicating with staff so much about, well, what do you think of this? Of course, we want to always involve people, but it's really about setting a stage. It's about creating a culture, and really whatever your steps are in that, you want to ask yourself, is this creating the culture that we want? And again, that it looks different for everyone. So in the slides, we gave just a few examples, and the training that I would recommend is really basic like 101, how to, we wanted to talk about defining, a couple definitions so that when someone says, identify as, someone kind of has a vague idea. Although I did want to mention that terms can mean something different to everyone. So you always want to ask, what does that mean to you? Just to make sure, again, we're not making assumptions. And then from there, the terminology, using pronouns properly, practicing pronouns. A friend of mine told me that the way that they learned how to practice pronouns was they assigned their cat they, them pronouns because it sounded like grammatically funny to use they, them. And when they assign their cat the they, them pronoun, that's how they would always refer to them rather than he or she traditional. So that was something that was really helpful. So I tell people that because it's kind of just a way to really start to make a small difference. And practicing is important. And again, these trainings, Sue and I provide them for free, but there are a lot available, and we have, Courtney, I don't know if you wanted to mention, on the resource page, we have the mini module that has an LGBT 101. And it's a really good place to start. So again, the resources are out there if you're looking for them.
Yeah, and I'm glad Rachel did mention the mini modules. They're 15 minutes. There's a variety of topics on them, and we're going to keep adding to them. So that's a great way to get your feet wet. And someone did ask in the chat if you were able to do this presentation to their organization in the future, and I heard you guys say that, yes, that was a possibility, correct?
Absolutely. Yep.
I'm sorry, I'm going back and forth because I'm furiously taking the questions out of the chat and putting them to the screen to my right. So let me make sure I don't miss anything. Someone wanted to know, are there training or resources on how to educate youth, such as this person has a 5-year-old daughter and they've run into situations where their child has generalized something as male or female, and they're wondering how to best educate their child at a young age?
I think that there's lots of stuff out there. I would look at some of the groups like the Trevor Project, which is really aimed at youth. Human Rights Campaign also has things about how to be an ally. I'm not sure how much they have aimed at a 5-year-old, but I think a real piece of it is also just parents role modeling this for kids, because kids watch TV. They're like little sponges. They pull everything in from TV in the community. And we sometimes miss how much they're pulling in that may be negative or not welcoming. So I think sometimes what happens is parents need to just sit down and talk to them about there's a lot of different people out there. And I think we sometimes just don't realize that kids are pulling it off of the TV and they're out of what their friends are saying and their friends' parents. And it's important for parents. So I would say Trevor Project, Human Rights Campaign are two of the big ones too that would have stuff aimed at kids.
Excellent, thank you.
I also put a link in the chat for familyequality.org because they have a lot of resources surrounding that as well.
Excellent, thank you, Rachel. Let's see, a question came in. In the workforce, this person sees addresses and emails coming out by directors or other management staff and emails as ladies, which seems to happen often. Are there any suggestions on how to address this, Rachel or Sue? I'm not sure which one wants to take this question.
That might be something that I think, depending on the size of the agency and your relationship to that person, if it was someone at my agency, I would probably just approach them and say, hey, we're trying to be inclusive to everyone. Do you realize that not everyone identifies as ladies? And even folks who identify as female don't always like the term ladies. So it's just a sensitivity thing. In a bigger organization, somebody who didn't feel comfortable with that might want to go to HR or the HR department and ask them to address it. But This is just about inclusivity, and what we need to really think about, this is both internally and externally, it's customer service. Whether the customers are our own staff and making them feel welcome, or whether it's people coming in through our doors. And it's a concept of, regardless of how somebody identifies, we just want people to feel that they belong.
Thank you, Sue. I also saw a lot of really nice comments come on. So I do encourage anyone who still has questions, put them in the chat, but I do want to read a couple of these comments. Jessica, one of the attendees, said, I don't have any questions, but I would like the presenters to know that this has been a wonderful training. Thank you so much for the information. Your calm, concise delivery has been an absolute pleasure to listen to. I feel like I've learned a lot. Alicia, one of the other attendees, said, I want to chime in and agree with the previous commenter and agree wholeheartedly. Thank you. Another comment, Sue and Rachel, thank you so much for completing the story about Danny, because it truly brought everything full circle and pulled the heartstrings. So
well, thank you, everyone.
Great, thank you.
That was really wonderful. I don't see any other questions. Real last call if there's any other questions. Again, we are going to archive these presentations, both the slideshow and the recordings, on the conference's website, and it'll also be on the LGBTQ Supporting Mental Health and Wellbeing website that we created that Rachel kept talking about. Thank you very much.
It's a great resource. I mean, it's excellent. I could have gone on and on and on about resources available, but they're on there. So, you know, and if anyone does have a resource that is not on there, you know, let Courtney know, let myself or Sue know, and we'll make sure it gets on there.
Yes, and we
Nobody
do have a
ever knows
mailing
everything.
list. Yeah, no, we don't. We're always want to add resource, and also there is a link at the very top of that page that says to add our mailing list, and so we can send you more information as they come out. Also, if you would like a all or welcome sign, that's something that we created for the initial LGBTQ mental health and well-being series. We have plenty of those left, so shoot me an email, or anyone else from HI. We're happy to send you one of those all or welcome here signs. And we're going to put a link for that on the site too, so if people want to. I thought that was a great point that you brought up there, Rachel and Sue. Thank you so much. I do not see anything else in the chat, so we'll close out this first session of the summit. Thank you both very much. It was a wonderful way to kick off the AHI Leadership Summit.
Thank you for having us.
Opportunity.